Hey everyone, welcome back to The Explainer. Today we're doing something a little bit different. We're going to impartially map out a really fascinating spiritual and philosophical framework all about the roots, diagnoses, and resolutions of panic disorder. Today's content is derived directly from a specific lecture that presents a highly unique, karmic perspective on mental and physical distress. We aren't looking at this through a medical lens today, but rather exploring a structured, generational belief system exactly as it is presented in our source material. It's a compelling look at how some philosophies view illness not just as a breakdown, but as a profound signal. All right, let's jump right into the structure for today. We're going to cover 1. The 2 roots of panic, 2. The ancestral connection, 3. The 30-70 rule, 4. Avoiding quick fixes, and finally, 5. Breaking the cycle. Starting off with Section 1, the 2 roots of panic and the origins of distress. So according to our source lecture, panic disorder doesn't just pop up out of nowhere, right? It's not random. Within this framework, it actually stems from one of 2 very distinct origins. On the one hand, you've got direct environmental stress. This is when you're, pushing way too hard in your own life, hitting intense frustrations, or maybe dealing with out-of-control ambitions. The philosophy says that when things don't go your way, it creates a literal blockage of energy. It's kind of like a localized fire or intense pressure that eventually bursts out as panic. But on the flip side, we have something way bigger, the ancestral generational root. This is an inherited burden. It means the panic isn't actually coming from your immediate surroundings. Instead, you're absorbing unresolved, blocked energy that's been passed down through your family line. Moving right along to Section 2, the ancestral connection and unresolved family karma. Let's unpack how those unresolved issues from the past actually show up in the present. This ancestral connection operates through very specific spiritual mechanisms known as Bingyi and Sinjol. Think of it literally like an invisible spiritual cord linking you to your unresolved family history. The idea is that ancestors who passed away carrying intense sorrow, unfulfilled duties, or just deep regrets, well, they don't simply disappear. Their energy sticks around. They use this cord to seek resolution through their living descendants. And how exactly do they get your attention? They manifest their pleas as intense physical symptoms. We're talking severe chest tightness or splitting headaches, which, are the classic hallmarks of panic disorder. Now, the timeline here is super specific. Unresolved pain from specifically within the last 3 generations is what actively travels down the lineage. So if a grandparent or a great-grandparent lived through a totally stifling environment or had a bitter life they just couldn't untangle, that energy isn't wiped out when they pass. It flows down through the intervening generations, ultimately landing squarely on you, the present generation. Your symptoms, viewed through this lens, absolutely aren't a brain malfunction. They are a desperate intergenerational signal for help. Okay, Section 3, the 30-70 rule, and figuring out exactly who must study. What's really fascinating here is how the source introduces a strict, almost mathematical tool to figure out exactly whose responsibility it is to fix the issue. The burden is divided using a 30-70 ratio. Let's break down the first scenario. If a patient is experiencing panic but is only 30% ill, that means they still retain 70% of their mental and physical faculties. They can walk, they can talk, they can think pretty clearly, even with occasional chest tightness. In this framework, possessing 70% of your faculties means you possess the capability and therefore the absolute responsibility to actively seek out spiritual study and resolve the issue yourself. You literally cannot outsource the work. But look at what happens when we flip that ratio. If the patient is 70% ill, meaning they're effectively bedridden, completely overwhelmed by panic, and operating on less than 30% of their normal faculties, they just lack the capacity to study or fix themselves. So what happens? The heavy burden of spiritual effort completely shifts to the surrounding family members. Now, in these cases, the family usually feels incredibly frustrated. But get this, that frustration is actually by design. The family's distress is the universe's way of forcing those family members themselves to study, reflect, and fix the household's environment. Which brings us to Section 4, avoiding quick fixes and why rituals fail. To really understand the path forward, we first have to look at what the lecture explicitly warns against doing. There's a huge caution against this highly predictable cycle of failure that desperate families tend to fall into. Step 1. The family feels the immense frustration of having a sick loved one. Step 2. Instead of doing the really hard internal work, they hire an external authority, like a shaman, a pastor, or a monk, to perform a ritual, a prayer, or maybe an exorcism. Step 3. They might actually get a brief moment of temporary relief. But Step 4 is practically guaranteed within this framework. The problem returns, and it returns way stronger than before. So, why exactly do these superficial solutions fail so badly? Well, they're just temporary band-aids. The framework dictates that external forces absolutely cannot replace the required internal effort of the family or the individual. In fact, if an external ritual temporarily wipes out the symptom without the family doing the required spiritual study, it actually angers the whole energetic system. Bypassing this mandatory effort just ensures the problem is sent back with even greater force. It's a much harsher karmic consequence. And if you continue to just ignore it until you pass away, you guessed it, the illness will eventually pass down to your descendants, and the whole generational cycle just keeps on spinning. Finally, let's head into Section 5, breaking the cycle and finding permanent resolution. Let's transition over to the ultimate solution proposed to permanently halt all this generational suffering. The true, lasting cure relies on a concept called Jungbub. Now, Jungbub translates roughly to study, but we aren't talking about academic reading from a textbook here. Jungbub is deep spiritual study and right living. It requires you to profoundly understand the flawed environment and the behavioral missteps that cause the illness in the first place. It is a total commitment to living a meaningful, purposeful life that actively resolves the root friction that plagued your family line to begin with. This quote really captures the heart of the philosophy perfectly. It argues that when descendants finally understand their environment, live fully, and do the righteous, rewarding work that their ancestors failed to do, it acts as a retroactive liberation. You are essentially untangling the spiritual knots for your entire ancestral line. The ancestors witness you living correctly, their lingering sorrow is resolved, they become joyful, and that spiritual cord of illness, it's finally detached. But the stakes in this framework are absolute. We talked about that 70% illness threshold a minute ago. Well, 70% is the final alarm bell. If a person ignores these agonizing signals, totally refuses to do their Jungbub, and wastes their time seeking superficial quick fixes, they will inevitably hit 100%. At 100%, the illness consumes the individual completely. It leads to total life collapse or even death, meaning the failure is sealed and the whole heavy burden is just passed right on to the next generation. I'll leave you with this final, truly provocative thought from the framework we've explored today. Whether you view this strictly as a spiritual philosophy or maybe as a really powerful metaphor for generational trauma, it asks us to completely reframe our struggles. Instead of merely fighting an illness or a frustration as an enemy, consider this. What is your environment trying to teach you? What is the deep friction in your life or your family's life asking you to finally learn? Thank you so much for joining me on this explainer today, and keep questioning the deeper layers of the world around you.